Hello, happy Wednesday, happy hump day. Welcome to another episode of Discover with Spinetti. I'm your host, Dr. Spinetti. Today we are talking about how to prevent getting cavities. We're getting down to the basics because it's the basics that we all start from. And cavities, believe it or not, happen in stages, but there are three main things that are required in order for you to get a cavity. Without those three things, without any one of those three things, it's impossible for you to even get a cavity. Literally impossible. So that's what we're going to go through today. Cavities. How do they form? Cavities form through a triad, through a intermixing or three different components, which is sugar. So the first thing you need is sugar. Second thing you need is bacteria. And of course, you need teeth. If you miss any of those things, so if you don't have bacteria, so if you miss bacteria and you just have sugar, so you eat a lot of sugar and you have your teeth, you're never going to get a cavity. I know, shocking, right? But that's it. You will never get a cavity if you don't have bacteria that cause cavities in your mouth. And actually, I do have those type of patients. I have patients that don't have any cavities because they don't have a lot of those bacteria that actually cause the cavities, believe it or not. But usually, and this is just as an aside, usually people who don't develop cavities because they don't have that type of bacteria inside their mouth or they don't have a lot of it, they end up having an aggressive type of periodontitis. So it's either people have a propensity to have a very high likelihood of them getting cavities, or they don't have a high chance of getting cavities, but then they have a high chance of getting periodontal disease. They're both bad. But that's what you need in order for you to get a cavity. You need bacteria, sugar, and teeth. Obviously, if you don't have teeth, then you're not going to get a cavity. If you don't consume sugar, right? So my nephew asked me, he said, if I just ate meat and vegetables, would I get a cavity? I said, it's not possible. It's actually not even possible for you to get a cavity. He said, so I can eat and I can never brush my teeth. I'm like, never brush your teeth. I'm like, like, how are you going to get a cavity if you're all you're eating is meat and vegetables? Like, how are you going to get a cavity? Right? You need bread, you need processed foods, you need refined sugars, you need a high content of fruits or dried fruits. You need sugar. You need something that is going to allow the bacteria to consume, like some kind of carbohydrate, to consume it so it can produce the acid, and then the acid will then demineralize the tooth and cause this. So this here I prepared for you. This here is an example. Okay, I looked it up on Google. I just typed cavities, as you can see here. So I typed cavities. I'm going to minimize my face so you can see this more clearly. And you can see here examples of cavities. So you can see, I'm going to just show you here. Okay, so here you can see stages of tooth decay. So stages of tooth decay. So you have a white spot. A white spot lesion just means that's the initial phase of getting a cavity. So when your enamel starts to get demineralized because of acid, so acid attack on the enamel causes demineralization, which means the breakdown of the enamel due to the acid. So when that starts to happen, you start getting something like a white spot lesion. It becomes white, like paper white. Okay, it becomes like very, very white, like chalky white. And the reason is because light doesn't reflect the same way that it does when the enamel is actually intact. When the enamel is intact, you get a different color than when the enamel is demineralized because of how the light interacts, because now the light bounces at different angles. So now you're going to get a different reflection. So that's a white spot lesion. That's the first sign of getting a cavity. Then you have they called it enamel decay, but it's further demineralization. So further demineralization causes this staining, okay, or like this discoloration of your tooth. Now, does that mean that now more than likely a lot of you are going to look in the mirror and say, "Oh, I have a lot of these stains. Does that mean I have cavities?" Yes and no. So let me explain. There is such thing as stains. However, stains are not cavities. But when you have these dark very, very dark things inside the grooves of the teeth, that means that you do have a cavity, but that cavity, if that cavity is it's stopped, or we call it arrested, it's been remineralized. So that area has been remineralized. Believe it or not, early cavities can be remineralized. I know. I know it's shocking. That's why I'm doing this, so I can shock you and give you the shock factor. So if you have an early cavity, and this is what we're talking about here, if you have an early sign of cavity, so you have, that dark spot, now you see it dark. Okay, we call it staining just to kind of explain it easier for you, but it's a first sign of a cavity. But if it's hard, if it's not sticky, that's why when the dentist picks up their instrument, it's called an explorer, that thing that has a sharp end to it, and then they start to poke and they start to tap on the tooth to see whether or not there's any stickiness. Because if it's sticky, that means that the cavity is active, and if the cavity is active and we leave it, then it's only going to get bigger, and it's going to demineralize more of your tooth. Because once it starts getting active and it starts to demineralize your tooth, then it's just a cycle, because the more that you eat, obviously you're going to keep eating, then you're going to feed it more, and then it's going to cause more and more havoc, and you lose more and more of your tooth. But if that area, even though it's black, for instance, if that area is hard, that means that cavity has arrested. It means it stopped. That's when the dentist says, oh, there's no concern. The cavity stopped. Can the cavity then can it reactivate? Of course it can, right? It just means that you took care of your teeth. So you started going to the dentist more regularly. You started brushing more regularly. You started being more diligent in your brushing, meaning you're actually paying attention to brushing all the way in the back, which seems to be the area that most people miss, the ones all the way in the back on the top and bottom. That means now you're feeding, or you're removing the plaque and you're feeding it fluoride. So now your tooth became remineralized and you stopped the cavity. But that only happens if the cavity is early. If the cavity is late, okay, so let me minimize my face here, just show it to you. If the cavity is late, like here, so if it attacks the second layer of your tooth, now it's late. Now you cannot remineralize that area anymore. That's it. Okay, so now the dentist has to go in and has to stop it by removing that area. So that entire area has to be removed, and then a filling is put in place. That's what is required so that the cavity doesn't go further, because if the cavity is allowed to go further, then it may involve the pulp, which is the nerve, and then you get an infection in the nerve and then in the bone, and then it really starts to hurt. So when does it hurt? It starts to hurt when the cavity crosses this barrier, when it goes into the dentin. That's when pain starts to develop. That's how you know it's too late. And one of the early signs of these kind of pains is pain to sweet foods. So if you're eating sweet foods, let's say you eat cake or eat cookie, whatever, and then you get this like sharp pain, then you know, okay, I have to go see the dentist so that they can stop this cavity. Does it mean that if you have sensitivity, excuse me, does it mean if you have sensitivity that automatically you have a cavity? No, it doesn't. Because if you have your inflammation of the gums, so if your gums are inflamed, they're not healthy, they will give you very similar symptoms to a tooth that has a cavity. So that's when you go to the dentist tests different things, does their tests, and then sees whether or not the actual tooth has a cavity or whether your gums are inflamed. And I can't tell you how many times a person has come to my office and they think they have a cavity and take an x-ray, and I have a look and I do my test and the tooth is good and everything is good except their tooth is inflamed. Their gums are inflamed. And because their gums are inflamed, they're giving them the same symptoms. And so when I tell them, I say, look, I just need you to do X, Y, and Z to get your gums back to health. And in a week's time, 2 weeks' time, those symptoms are completely gone. Okay, but it's that worry. And it's a good thing to be worried so that you know that you're not actually doing hard to yourself. Okay. Now, how do you avoid cavities? How do you avoid cavities? Okay, because here the actual title of this podcast is how to prevent cavities in your mouth. So how do you prevent cavities? Now that you know the early signs and kind of the late signs of cavities, you know the three things that are necessary for you to get cavities. how do you prevent getting cavities? It's actually quite simple. What happens is that when you consume bacteria, not you don't consume bacteria, when you consume sugars, the bacteria, they stick to the tooth. Okay, they stick to the tooth, but on a film called a biofilm. Okay, biofilm is that stuff, that slimy stuff that sticks to your teeth, and it has a lot of bacteria. Well, over time, if it's left there, if it's not disturbed, over time it starts to develop into plaque. So it starts to, become bigger. And then if it's left there, it becomes into calculus, which is a very hard, it's a hardened plaque. And then once it becomes the calculus, then it's very difficult for you to remove, if at all. And then you definitely have to see the dentist so that the hygienist can remove that plaque, rather the calculus. So how do you prevent cavities? You need to disturb that area. You need to disturb the biofilm, the plaque. You need to disturb it from the tooth. How do you disturb it? Toothbrush. Okay, so toothbrush disturbs it. That's the whole point of actually brushing your teeth, is that you're disturbing the plaque, you're disturbing the biofilm. Because if you allow bacteria to just stick on your tooth, so it just sticks there, and obviously you're feeding it sugars and whatnot, and the bacteria and the enzymes inside your mouth are breaking down the sugars, and the sugars are being consumed by the bacteria. Well, then the bacteria is already stuck to your tooth. Now the bacteria is going to secrete acid because of their metabolism, and then the acid is going to demineralize the tooth, and you're going to start getting these signs of cavities. So that's what happens. So how do you prevent cavities? The easiest way, I'm not even telling you to stop, anything like in terms of changing your diet habits or stuff like that. But the quickest way for you to prevent getting cavities is for you to disturb the biofilm. Now, the second way for you to prevent cavities, because I do have a lot of patients in this category as well who do brush regularly and floss regularly, but they still get cavities. And invariably, what I ask them all the time, I say, do you snack frequently? And they say, yes, I do snack frequently. And because they snack frequently, the biofilm, it's almost impossible, unless you're carrying a toothbrush in your pocket, it's almost impossible for you to disturb the plaque, because now you're feeding it all this sugar and all this acid and all this stuff, this refined sugars and stuff like that, consistently throughout the day. So now you're giving the bacteria the environment for it to actually cause a lot of demineralization of your tooth, which then leads to cavities. So how can you prevent cavities? One, disturb the plaque. Two, decrease the amount of snacking that you do, because the less snacking that you do, the more favorable the environment in your mouth, the more neutral the environment in your mouth, and then therefore you won't get as many cavities, if at all. And that's it for today. So if you have any questions regarding cavities, please feel free to feed them to us. We're more than happy to answer any of the questions that you have. And make sure that you use the floss, because floss is the thing that actually, I didn't talk about that, so I'm mentioning it, is floss is the thing that actually disturbs the plaque or disturbs the biofilm in between your teeth. The brush disturbs the things on and around your teeth, but in between your teeth, obviously the brush can't get it. And so that's why you just use the floss, and it's very easy to use the floss. I know everyone hates it, but you just use the floss, and then that floss then allows you to disturb the plaque and prevents the cavities from happening in between your teeth. Have yourself a wonderful Wednesday, and as always, keep smiling.